Actually, my PSA test came up to 17.2 in August of 2010, but I found out about it after the cataract surgery. So the doctor felt that perhaps I just had a infection in the prostate, and I went to see a urologist who also felt that that could be the case. They put me on antibiotics. I took antibiotics for a month. I came back in October 25th. My PSA had gone down to 7.1. Dr. Miller, my urologist, said that we could try antibiotics a while further and it might improve it, or we could do the biopsy. I told him I wanted to do the biopsy. One, because of the insurance situation. Number two, I just wanted to know. So we did the biopsy, and they took 10 tissue samples. All 5 on one side were cancerous, and one of the other 5 on the other side were cancerous. So now I knew what to face. I asked Dr. Miller for his input. I knew we had to do the bone scan and the CT scan. The most important thing was to make sure the cancer had not spread, and fortunately it had not. That all came out quite well. I asked him for some input. I asked him for some companies. He sent me to a couple of places, US2 International, which I looked up on the computer, and to Prostate Cancer Foundation, which they mailed me some tremendous information. And I told myself I wanted to educate myself as we went through this, and I wanted to know where I stood and what had to be done. So I met with Dr. Lederer, my radiation oncologist, and we discussed my options. He did not say surgery, which in all honesty I'm not sure I would have had the surgery. That would have been a very difficult decision. I felt there had to be other options. Dr. Lederer suggested hormone treatments, which I already started with Dr. Miller. Just a shot in the butt, not a big deal. He suggested exterior radiation and in turn to a brachytherapy. In regards to the exterior radiation, he asked me if I had ever heard of the Calypso implant, or the Calypso procedure, and I had not. And he asked me to research it, Google it, and look at it. And basically what the Calypso does is, it's an amazing thing. Radiation is indiscriminate. Radiation will kill healthy cells as well as cancer cells. The Calypso implant, they actually go in and implant 3 little rice grain sized radioactive transmitters directly in the prostate. And these transmitters can communicate with the radiation machine and direct the radiation directly to the cancer cells and save the good cells, which was an exciting opportunity for me. I asked him, because this was new, would my insurance cover it? And he said probably not, and if they didn't, not to worry about it. He would not charge me for it. I was like the 50th person in the state of Hawaii to get this procedure. He and Dr. Miller both realized that they had to present that they're going to have to perform this procedure in order to convince the insurance companies it was worthwhile. And in all honesty, I had the procedure done. They never asked me for a penny. My insurance did not cover it. But I was fortunate there. So we went in, we did that. I went through 25 days of exterior radiation treatment. And I was lucky. I had no side effects, no problems. I think one day out of that, I felt a little bit tired. And I think perhaps the Calypso has something to do with that. But the radiation really was a breeze. And I was surrounded by some good people, some great doctors and nurses, and we pressed on. In May, it was time for the brachytherapy. And in May of 2011, they went in and implanted 59 rice grain sized seeds direct to my prostate. And then the wait started. My next PSA test would not be done until September. The only side effects I had after the brachytherapy was some problems with my bowels. And that's all cleared up, it's all gone. There's never been a problem in the last many months.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.